Hi all, Dr. Raman Sakhuja here, consultant psychiatrist and a honorary professor of psychiatry with the University of South Wales. And a warm welcome to my channel. And today we have once again a very special guest, a very experienced child and adolescent psychiatrist who has not only worked in UK but also has a lot of experience from the American continent and has worked in Canada. And I'd like to welcome him to this channel. Welcome, Dr. Sharma.
Thank you, Dr. Sakhuja. Thank you.
And today, what I would like to do for this video is address some of the questions that have come to us via our channel, and some of the patients often ask these as well. And I thought there would be no better person other than Dr. Sharma to help us navigate some of these questions. So before we start, if you have not already seen one of the previous videos that we have done on the issues where women present with ADHD differently, then please go and watch that and then come back. And we'll go straight into the questions. So what I want to do, Dr. Sharma, today is to address three questions that have, it's a common theme that has, come through to us through the channel. So, one, do girls present differently? What are the common sort of presentations for girls who ultimately may go on to be diagnosed as ADHD? And are there any specific age related transitions that you notice? So I will just open up the floor for you to guide us through these questions.
Thank you very much, Dr. Sakhuja, for having me, first of all. I think this is a very valid question, which a lot of patients do ask me as well. The girls, they often present differently to the boys. Now, we often assume that ADHD means you should be busy, restless, fidgety, running around, but that does not happen in older age group. Girls particularly, they present what we call as an inattentive type of ADHD.
Yeah.
That means they are daydreamers. They'll be a little restless, little fidgety, but not necessarily noticed by the school or by the teachers. The girls often will be more shy, more quiet, and because girls are far more social than boys, they tend to mask it very well. School being structured environment, they go along with the flow. But once they're out of the structured environment, say in break times, lunch times, or outside the school, they often struggle.
That is something that is a very interesting phenomena that you just mentioned, because when I do see some of the adults, and specifically women, and go back into time and look at the history of schooling, they often would report that whilst they were in the school, there was an established structure. They were able to, manage and engage with the academics or whatever else. But once they went back home, that's where almost all hell broke loose, so to speak, and things were chaotic. So, is that something that you often see?
Yes, that's a not an uncommon presentation at all. Girls, they are able to, as I said, they kind of sail through the school structured environment. But again, when they don't have, when they as they grow, the more responsibility starts to fall on them, and if they have to do their own planning, they start to struggle more. So yes, unstructured times aren't the greatest times for them. The second question, what you asked was,
With the common presentations
yes.
that they have.
So as I said, now what also I have noticed is it is not a common presentation, but it is not common also, particularly in the later stage, especially when they are in their late teens. Often due to the difficulties they experience, the struggles they have, it starts to affect their self-esteem. So they present often with low self-esteem, anxiety, low mood, some self-harm,
Right.
sometimes impulsive overdoses. Relationship starts to show clear strains in the later stages. And also a, a significant percentage of ADHD late adolescent presentation will also indulge in themselves in the substance misuse. Very commonly, they come and tell me that they use this because as a part of self-medication. Although they start recreational, but because they get attracted towards all sorts of exciting things, and substance misuse is one of the exciting aspect of the life. So yes, I do see substance misuse, particularly cannabis use,
Right.
to mask their difficulties.
Yes. And I think cannabis use, we see that in adults quite a lot. And I think in adults, the most common ones that we come across are the cannabis and alcohol. But then there are also people with the amphetamine misuse.
Yeah.
And when I used to work in the addictions, I remember many of them were actually self-medicating because of an undiagnosed ADHD.
Yes, that's true. That's true.
No, thank you for that. So, what about are there any age-related transitional changes at all that you come across?
Yes, and it's quite striking how the presentation changes and how they present really during their school life years. In the primary school, particularly, I'm talking about girls over here, because they are quite a type, inattentive type, daydreamers, so they don't really present often. Once they move into the secondary school or comprehensive school, the responsibility increases, the social interaction part increases, the coursework becomes more difficult, and that's where they start to struggle. If they are missed around that age, then the second, third presentation will be mostly around their A levels, which is just pre-university levels, because more is expected of them. So they have to plan their own revision and coursework, and that's where they start to struggle. If they miss that, a lot of times, girls, particularly who are very bright, are able to sail through also. Bit of a struggle, but once they go to university where they are supposed to do everything by themselves, they become they start to struggle the most.
Yes, yes.
And I have come across quite a few of my patients who have gone to the university and then come back and have been diagnosed with ADHD.
That's I'm almost reassured that it's not just me who's seen that sort of population where once they are adults and in university, and they come and sort of have these difficulties and eventually get diagnosed. So that's very useful. So I think we have perhaps covered that girls present differently. Yes, they do. Are there common presentations? And you mentioned perhaps anxiety and a host of other conditions. And there are transition points in people's lives where added responsibility means that there's a high risk of the disorder manifesting itself.
Yes.
Yeah. Okay. One last thing that I wanted to check as we were talking about this is, when you're talking about those common presentations, so someone in adolescence may present with self-harm, substance misuse, emotional difficulties, and from an adult's point of view, they may start looking at it from the lens of an evolving personality, disorder. But actually, when we dig deep down, it may not necessarily be that. But what are your thoughts on that?
No, absolutely. This is which kind of I've learned over the years when they start to present with features which are very similar to the personality disorders. When you look into it and go back in their school years, and you get some kind of feedback from the parents and sometimes from the teachers, you start to realize that those difficulties weren't really as such evolving personality disorders, but was because of the ADHD, underlying ADHD features, which may not necessarily be severe. They probably are mostly mild to moderate, and they are bright girls. And as I said, girls can mask it in a structured environment very well. They are often missed, and their presentation changes as they grow older.
Okay, and I guess the female physiology is such that as they grow further beyond university, then you start seeing other transition points, suddenly getting into a high role with added responsibility and then coming closer to menopause. Those things can, take its toll. So no, that's quite a useful discussion. So I'd like to thank you once again for
Thank you.
joining us.
Thank you.
And if you guys have liked the discussions that we've had, then please continue to remain engaged. Do comment, because that helps us to bring out the questions that you put in the comments, for us to use those to make further videos to try and help you. And again, once again, if you do find this informative, do like, subscribe, share, comment, press that bell button icon so that you get notified for all the upcoming videos. And we shall see you very soon for the next video. Thank you. And thank you, Dr. Sharma.
Thank you.